To this now, there's been a warning of another COVID-19 wave in South Africa, but the National Institute of Communicable Diseases says no, not anytime soon, as cases are actually not that bad in South Africa. Let's speak to vaccinologist at Wits University, Professor Shabir Madhi, about this particular, what's been happening at the moment. Professor, thank you very much for your time here on eNCA. Firstly, we've seen Argentina, some parts, I think, of India and China also under lockdown because of the fact that those countries are experiencing new waves. Should we be worried in South Africa? Is there a need to panic?
So the short answer is that there isn't any need to panic. We can expect a resurgence, but even when there is a resurgence, it's very likely to be very modest, probably even less severe than what we experienced with the large resurgence earlier this year, where there was very few cases of hospitalization and death. China is a very different sort of a country with a very different sort of an approach to the pandemic, in that they're going for zero COVID-19 cases, and that is not realistic in a South African context. Our focus is about ensuring that we minimize hospitalization. And as I mentioned, with the previous wave, there were very few hospitalization and deaths, and substantially less than what we experienced over the course of the first 4 COVID waves. And we can expect that to be now moving forward. Substantial amount of immunity that has risen in the community, both from past infection as well as from vaccines.
So you're saying that we will see, numbers go up, etc., any time soon in South Africa. So how do we prepare ourselves? How do we make sure that the numbers are not as bad as we've seen before, even though, we have seen the waves that we have experienced recently are not as harsh, we agree, but, how would you advise South Africans to prepare themselves for the next wave?
Yeah, the best way that you can prepare yourself is to ensure that you're adequately vaccinated, and especially if you're in one of those risk groups of developing severe disease or dying of COVID-19. And as a proxy, that probably includes anyone above the age of 55, and certainly anyone with medical conditions, diabetes, such as obesity. For those individuals, they should be getting up to 3 to 4 doses of vaccine. And seeing that we're anticipating another resurgence taking place in the course of the next 4 to 6 weeks, now would be a good time for those high-risk individuals in particular to get the additional dose of vaccine.
And Prof, I think also the other problem right now when you talk about vaccines is that huge drive by government to get people to get vaccinated has died down. We're hearing of the possibility of the destroying of some of the vaccines that we've already procured and bought sometime in October, etc. Is that the right decision? And also, if, for instance, myself, who I got my 3rd jab of the Pfizer vaccine back in January, would I still be okay right now?
Well, for yourself, because you're relatively healthy, 3 doses of Pfizer vaccine should be adequate in certainly protecting you against being hospitalized. It might not be adequate in protecting you from being infected, especially with the Omicron variant and the sublineages of the Omicron variant, because after you've received the vaccine, about 2 to 3 months later, the antibody that's induced, which protects you against infection, has waned substantially. And if you're still wanting to protect yourself from being infected, then you might require even an additional dose. But that really is not the focus of vaccines. The prime reason for vaccines is to protect against hospitalization and death. So for the average South African, 90% of us have been infected at least once. And if you've been vaccinated, that combination of infection and vaccine-induced immunity performs extremely well in protecting against severe disease and death. But again, if you're unfortunately in that high-risk group, then you certainly require those additional doses of vaccine to top up your immunity and to top up your protection even against severe disease and death.
And the fact that we have basically stopped our huge drive to get vaccinated and convincing people to get vaccinated, etc., and now the possibility of thousands of vaccines to be destroyed in October, is that a good decision?
Well, it's really unfortunate, and it's actually into the millions of doses of vaccine that will be discarded, that will have expired by October. And I think government would be well advised to go on a further vaccine drive, but really to be targeted. As I mentioned, there's little value to be vaccinating the average 20-year-old or asking them to come forward for vaccination. But there's huge amount of value to target the SASA pay points as an example to ensure that people above the age of 60, 65, people that have got underlying medical conditions are getting those additional doses of vaccine. So it needs to be much more focused, much more targeted in terms of what we're trying to achieve, and that is to maximize protection against severe disease and death. So target those above the age of 55, 60, and those with underlying medical conditions. But there still is a need to continue a vaccine drive for that high-risk groups.
All right, Prof, thank you so much for your time. That is Wits Professor Shabir Madhi. He's a professor in vaccinology.